So it's Jennifer Doggett here from Croaky. I'm at ANU at the launch of the WHO Centre for Collaboration on Healthcare Workers Regulation, and I'm here with Professor Sharon Friel from RegNet at ANU. I'm not going to explain what RegNet stands for because it's a very long title, but I was just going to ask Sharon if she could comment on what she thinks this new centre is going to bring to the area of health workforce regulation, and in particular, what does the involvement of the WHO mean?
Yes,
Sharon.
so a WHO collaborating centre in health workforce regulation, which is what we've just had the launch of, really provides a very important convening power for health workforce practitioners, health system practitioners, to be able to share lessons of a regulatory nature here within Australia and across the region. WHO has this marvellous convening power and great technical expertise that provides opportunities to understand how do we achieve universal health care for all, which is the grand goal for WHO, and of course here in Australia. How do we achieve that? What are the sorts of regulatory systems that we need in place in Australia and across the region that enables people who enter into the health system know that they're going to get quality, safe, equitable treatment at every stage in the system? How can the practitioners, can we make sure that the practitioners are regulated in such a way that they have all the core competencies, all the core skills that are needed to ensure that safe and fair treatment for everybody? And the role of the World Health Organization to be able to bring together that sort of expertise, that sort of regulatory understanding, the sorts of universal health coverage understanding in countries as diverse as from Tuvalu to Australia to Papua New Guinea to Fiji to Cambodia, Vietnam. Really incredible for the Collaborating Centre to be in a position to engage with the World Health Organization to get this marvellous opportunity to work with people in all of these diverse countries and contexts. What's a challenge, of course, is the different regulatory systems across these different countries. And again, hopefully part of the technical guidance, the standards, the protocols that come from WHO, worked up in collaboration through this collaborating centre, will be really an incredibly helpful resource for people in Australia and beyond. So I think it's a marvellous thing. The collaborating centres, they give legitimacy, they give authority, they give convening power. People are going about their everyday jobs, doing great jobs for the health practitioners, the regulators, the consumers' organisations, but being part of that wider network gives all of these things that I've spoken about. It also gives a really strong voice for the practitioners, consumers in Australia to feed into the global decision-making processes via the World Health Organization and via the World Health Assembly. So if we want to really inform some of the global health policy discussions, because of course they flow back into countries, then going through this WHO Collaborating Centre is another really powerful mechanism. So we in Australia can help inform and advocate for action at the global level, and we can learn from, use, adapt all of the insights that are available through the World Health Organization globally and regionally back into the country. So I think a marvellous initiative.
That's great, thank you. And I just one extra question. I was quite struck by some of the comments today about how it's very much the centre is a two-way process where we will be providing some knowledge and expertise from the Australian perspective to other nations in the Pacific region, but also learning from them and learning from what their health systems and their cultures and health practices and regulatory practices. What do you think there's something that Australia can learn from someone who has had experience of health systems overseas? What's something that we can learn in our health system from another health system overseas, either in the Pacific region or somewhere else?
Yeah, I mean, there's lots of learnings. There's different places take different a principles-based approach to regulation, and that would be great to see that being brought more firmly into the Australian context. Other countries understand very strongly the power of community groups, the power of consumers' voices. Here in Australia, we've just heard from Darlene Cox, who's a marvellous representative for the Healthcare Consumers Organisation in Australia. So there's sort of amplifying the learning from the consumers' organisations. We can learn from the practices that have happened in other countries of which was also spoken about this morning, of this hybrid system of healthcare taking place within the Australian health system, and that's not always a good thing. That we really, if it's about universal health coverage, universal health care for everyone, we've got to be very critical of these public-private mechanisms, and there's lots of learnings and analysis from elsewhere. We could look to the US for how not to do it, for example. There's learnings for how you operate in a way where you're very resource constrained. So Australia's a rich country, we would argue we're not resource constrained, but sometimes we've got to tighten budgets, and we've got to work out how to do things with a smaller amount of money, and there are many countries, particularly some of the Pacific Island countries, who are really very resource poor, who have to get on and do things, and they demonstrate how you can be innovative. Not always, of course, there are incredible health problems in these countries, but so learning how you innovate, how you adapt, how you continual improvement. I think that's one of the powers of a global collaboration, is that you're getting to hear from this wide community of practice how to continually learn. That means we have to be open to the fact that we don't have all of the answers, and I certainly hope that would be something that we embed front and centre of the Collaborating Centre.
Great, thank you very much, Professor.